Hi all, today I am going to discuss about the topic IV fluids. This is a very familiar topic for all because this is very important topic both in nursing practice as well as in competitive examinations. So we are going into the definition of IV fluids. So next we are going into the definition of IV fluids. So IV fluids are intravenous fluids or sterile fluid solutions administered directly into a vein through an intravenous catheter to maintain, restore fluid volume, electrolytes, or energy requirements. Simply, we can say that these IV fluids replace fluid loss, restore circulating volume, correct electrolyte imbalance, provide energy. That is, some of the IV fluids contain glucose, such as D5, D25, which contain glucose, and that are help in providing energy. And some of the mass serve as a vehicle for medication administration. That is, NS is commonly used for medication administration. These are the common or general uses of IV fluid. So, we are going into the classification of IV fluids. IV fluids are majorly classified into three, that is, hypertonic, isotonic, and hypertonic. Then, uh, what is what is the hypertonic solution, isotonic solution, and hypertonic solution? Because these solutions are comparing with the osmolarity of the plasma. So plasma normal range of plasma osmolarity level is 257 to 310 millimoles per liter. If any fluid which has an osmolarity less than 275, it is called hypertonic solution. If any solution which has an osmolarity in between 275 to 295, it is isotonic solution. And if any solution have an osmolarity greater than 295, it is called a hypertonic solution. So, now we are going to discuss about the isotonic solutions. These are the solutions which are commonly used in our clinical setting. That is normal saline. Normal saline is an isotonic solution and its osmolarity is 308 millimoles per liter and the composition is sodium and chloride. Sodium is 154 milliequivalents per liter and chloride is also 154 milliequivalents per liter. And what all are the uses of sodium chloride? That is, sodium chloride is an isotonic solution. That is why they tend to remain in the intravascular space. So it can be a best option for fluid resuscitation and also it can help in hypovolemic shock because it tend to remain in the intravascular space and it will increase as the BP. Then it's act as like a volume expander and it helps to treat hyponatremia because it has a high sodium content, so it helps to treat hyponatremia. And it helps to treat metabolic alkalosis. Metabolic alkalosis may occur due to the chloride loss, so it has a rich amount of chloride and it will help in and treat metabolic alkalosis and compatible with all kind of drugs because it is used as a solvent. It helps to dilute. It is used for diluting all kind of medications. So it is compatible with all drug because it has an osmolarity which is similar to that of our plasma. Then dextrose 5% in water. And the main point here to remember is dextrose 5% in water is only isotonic in back. When the dextrose 5% in water enters the blood, it becomes hypertonic. How it become hypertonic? Because it has a glucose that is 50 gram per liter glucose in it. So these glucose when enters into the blood, it easily absorbs. So there is only water remain in the body. So that's why it is hypertonic in the body. Body it is hypertonic and it has an osmolarity of 252 millimoles per liter. So what all are the uses of dextrose 5% in water? The uses are it uses as a free water replacement and it helps in treating hypernatremia because it has no sodium content. So it will help in treating hypernatremia and it will give free water. So free water will dilute the salt that will help in hypernatremia, and it help in dehydration because this D5 dextrose 5% in water, when it enters into the body, we says that only water will remain in the blood, and it is and it only not remain only in the extracellular space, it will be absorbed into the intracellular space also. So it is an intracellular plus extracellular fluid. So it will enters into the tissue and it helps in dehydration. It helps in treating dehydration. So it rehydrates the cells. Then that's why it's not used for resuscitation because it's not remain in the intravascular space. So it will not increases the BP. So we are not using this for resuscitation. Next and the last one in the isotonic solution is Ringer lactate. So Ringer lactate's other name is, I will write it. Ringer lactate's other name is Hartmann's. Sorry, it's not working. Ringer lactate other name is Hartmann solution. Okay, it's also an isotonic solution and it has the same osmolarity of the plasma, and it has an osmolarity of 270. It has an osmolarity of 273 millimoles per liter. And what all are the composition of Ringer lactate? The main composition of Ringer lactates is sodium, potassium, calcium, chloride, and lactate. That's why it is called as an uh, uh, good electrolyte, mostly all balanced electrolyte, balanced fluid or balanced, it has most electrolyte, so it is called as a balanced fluid. So it has a sodium of 130 milliequivalents per liter and has a potassium of 4 milliequivalents per liter and has calcium of 3 milliequivalents per liter, chloride 109 milliequivalents per liter, lactate 28 milliequivalents per liter. And the RL is the best fluid of choice for burns and diarrhea. So burns patient, diarrhea patient mostly using RL, and it helps in fluid resuscitation, burns, trauma, diarrhea, and it helps in treating metabolic acidosis. Because if we are treating metabolic alkalosis vigorously, that tended to cause metabolic acidosis because there is high sodium, high chloride. If we are treating metabolic alkalosis with NS, then that will cause metabolic acidosis. How causes metabolic acidosis? Because this metabolic acidosis is occurs due to hyperchloremic metabolic acidosis. Chloride will increases and will leads to metabolic acidosis. Because if chloride is increases, that mm, that will happen. That will act in the kidney and kidney will release a large amount of bicarbonate. There is bicarbonate amount will base level will decreases, that will leads to metabolic acidosis. So we have to give some fluid which doesn't have a chloride. That is why it helps in treating metabolic acidosis. These all are the isotonic solutions. Okay, and the next thing is we said that dextrose 5% in water have glucose in it. So if there is glucose, if there is sugar, there is chance of having calorie. Okay, so 1 liter of dextrose 5% in water have 200 calories. This 200 calories is given by glucose 50 gram in 1 liter of D5W. Okay, but normal saline Ringer lactate have no calories. Only isotonic fluid which have calorie is dextrose 5% in water. Remember that. Okay. The 0 calorie fluids are Ringer lactate 0.9% NS. So now we are going to discuss about the hypotonic solutions. Then what is hypotonic solution? This is not lower osmolarity than plasma. Hypotonic solution have an osmolarity lower osmolarity than plasma. It has an osmolarity which is less than plasma. That is why it is called hypotonic solutions. So if It is a hypertonic solution, which means its solute content is low and water content is high. So water will move from a higher concentrated space to a lower concentrated space. So water shift into the cell, and which will in turn leads to cellular edema. So these hypertonic solutions should be administered cautiously to prevent the cellular edema. That is why hypertonic solutions are vigilantly used for patient with cerebral edema. So it will increase cerebral edema. So what are the examples of hypertonic solutions? First one is half NS, next one is 1 by 3 NS, and next one is 2.5% dextrose in water. So half NS means it is half of that that normal NS, which means its osmolarity is half of the normal NS. The osmolarity of NS is 308. So half of that is 154, and the content is also same, sodium and chloride, and it is also become half 154 there. Half of 154 is 77. That is sodium is 77, chloride is 77, and half NS is used for hyponatremia. Then next one is 1 by 3 NS. 1 by 3 NS is also half of this. That is osmolarity will be half of 154. That is 77 millimoles per liter. And the content is also same, sodium and chloride. And it is also half of this, 38 and 38. And it's also used for hypernatremia. Then what is 2.5% dextrose in water? In isotonic solution, there is 5% dextrose in water, and hypertonic solution, half of the 5% dextrose, half percentage, that is 2.5% dextrose in water. And the osmolarity is 126 millimoles per liter. What is the osmolarity of 5% dextrose? That is 273 millimoles per liter. Then half of that is approximately 126 millimoles per liter. And what are the content? What is the dextrose or glucose content in 5% dextrose? That is 50 gram. But in 2.5%, half of that, that is 25 gram per liter. So it is used in dehydration, because we already know that in D25 only water remain. So this water help in treating dehydration. Then already the others point we were discussed. Hypertonic solution shift water into cells, and this will cause risk of cerebral edema. And if a patient have already cerebral edema, this will worsen the cerebral edema. Use in pediatric patient with caution. And excessive use can lead to hyponatremia. We are treating hyponatremia. If excessively we are treating hyponatremia, if vigorously we are treating hyponatremia, that will lead to, if we are treating hypernatremia, if we are vigorously treating hypernatremia, which can lead to hyponatremia. So monitor fluid balance and electrolyte. What are the clinical pulse? Monitor fluid balance and electrolyte. If we are treating hypernatremia, we have to monitor sodium electrolyte, sodium and potassium. Watch for signs of fluid overload, because this can cause cellular edema, for confusion, seizures, because if there is hyponatremia, there is a chance of the first sign is headache, confusion, and the last sign is seizure, coma, death. So sodium is a major electrolyte that we have to watch closely. That can be sodium, low sodium can be lead to death. Do not administer rapid large volume unless especially specifically indicated. Next, we are going into, okay, we are in the last part of this session. We are today we are only discussing about the hypertonic and isotonic solution. Hypertonic solution will be discussed later. So we have to solve some questions. Uh, Before that, we have a short bullet point about isotonic solutions and hypertonic solution. The osmolarity equal to plasma, that is 275 to 295 millimoles per liter. No significant shift of water between ECF and ICF. So in isotonic solution tended to remain in the intravascular space. That is why it will increase BP and treat in hypovolemic shock. Primarily expand extracellular fluids. It's only expand extracellular fluids. Example, half NS, ringer lactase, dextrose 5% in water. It's only isotonic in bag. Then what is hypertonic solution? That is osmolarity lower than the plasma, and the water move into cells by osmosis, cast cellular celling. Example, half NS, 1 by 3 NS, 2.5% dextrose. Then we have to move into uh, questions. Okay. What is an isotonic solutions? Isotonic solution. What is isotonic solution? Which lower osmolarity than plasma, higher osmolarity than plasma, equal osmolarity to plasma, no osmotic activity. No. Isotonic solution has an equal osmolarity to plasma. What is a hypertonic solution? Hypo means lower osmolarity than plasma. Which IV fluid is isotonic? Half NS, 1 by 3 NS, NS sterile water. That is simple questions, half NS. Which of the following is a hypertonic solution? Hypertonic solution, half NS, NS, normal saline, ringer lactate, 3% NS. And this half NS is isotonic, half NS is hypertonic, NS is isotonic, ringer lactate is isotonic, 3% NS is hypertonic. So the answer is half NS. Water movement with the hypertonic solution is from cell to ECF, into cell, remain in blood vessels. So from cell to ECF, that is causing hypertonic solutions. Hypertonic solutions causes the cell shrinkage that will be studied in the next class. Into cell, these are the same answers. Remain in blood vessels, that is isotonic solution. So the answer is water move into the cell by osmosis. The appropriate osmolarity of 0.9% NS is 154. No, 154 is the osmolarity of half NS. 77. No, 77 is the osmolarity of 1 by 3 NS. 308 is the correct answer. 308 is the osmolarity of normal saline. 513 is the osmolarity of 3% NS. We will study later. The approximate osmolarity of half NS osmolarity is half of 308. That is 154. Which fluid is used mainly to replace intercellular water deficit? Which fluid is mostly used to rehydrate the cell? That is half NS. Membritic isotonic stay outside, hypotonic goes inside. Which patient requires caution while administering hypertonic solution? We already discussed that patient with a cerebral edema. Excessive administration of hypertonic solution can cause excessive administration of hypertonic solutions are already used for treating hypernatremia. If we are vigorously treating hypernatremia, it can lead to hyponatremia and cellular edema. Isotonic solutions primarily expanded. Yeah, isotonic solutions are expanding extracellular compartment. Intracellular compartment, only intracellular compartment is not expanding by the isotonic solution. Isotonic solution increasing extracellular compartment, which including intracellular compartment. Intracellular swelling is causing due to intracellular volume is increased due to hypotonic solution. So expand extracellular. Extracellular compartment is expanded by isotonic solution. Both intracellular and extracellular is equally by. That is why D5 will cause goes into both the ECF and ICF. Which of the following is an neither ICF nor ECF? Sorry, nothing is there. If we are giving through our veins, either they will increase ECF or nor will either no or will it increase ICF. Which of the following is an example of isotonic balanced crystalloid? That is isotonic balanced crystalloid is ringer lactate because it is called the Hartmann solution. It has sodium, it has potassium, it has calcium, it has chloride. So it has lactate. So it is a balanced electrolyte, balanced crystalloid. D5, dextrose 5% in water in the bag is isotonic, but physiologically it acts, everyone knows that, hypotonic. Which fluid is most appropriate for initiate resuscitation? It's also known half NS because it is a volume, act as a volume expander, which is the key nursing responsibility during administering hypotonic solutions because it can cause cerebral edema. So monitor for cerebral edema. Okay, this is all about the class. I think it is very helpful for all of you. So I am wind up in the class. Thank you.